Welcome back to another episode of HealthCap Weekly Wrap. This week, we're bringing you a wide-ranging mix of stories that matter to anyone working in or connected to senior living. From a surprising new FDA warning about allergy medications, to innovative fall risk technology, to a hard look at the challenges facing assisted living communities, we've got you covered.
Plus, we'll explore the latest research on managing sepsis, the resurgence of tuberculosis, and a closer look at how federal policies are shifting for dialysis and caregiver support. And we'll talk about proposed legislation aimed at expanding visitation rights in assisted living. Finally, we'll wrap up with a reality check on where the industry is headed.
Let's dive in.
So, the FDA just added a new warning to two popular allergy medications, cetirizine and levocetirizine.
Yeah, those are Zyrtec and Xyzal. The warning comes directly from the FDA, and it's about rare but severe itching that can happen after stopping long-term use.
Exactly. It's not your typical mild itch either. Some people experience full-body, persistent itching that can last for weeks, and it doesn't always respond to antihistamines.
What's interesting is that this only seems to happen after someone's been taking these meds daily for months or even years, then suddenly stops.
Right? And the itching might not start right away. It can be delayed by a few days, which makes it harder to connect to the medication.
According to the FDA safety notice, they reviewed dozens of cases and found this pattern was consistent enough to require label changes.
So now, both prescription and over-the-counter versions of these drugs will include a warning about this itching risk.
This matters in senior living communities where residents often take these kinds of meds regularly, sometimes without it being closely tracked.
If a resident starts experiencing unexplained itching, it's worth checking if they recently stopped taking one of these.
And it's a reminder to always review OTC use during medication reconciliation, especially for long-term daily meds.
Let's head into our next story, which looks at a new approach to managing sepsis. This one comes from McKnight's Long-Term Care News.
Yeah, so researchers may have found a better way to measure outcomes in sepsis care.
Right? Instead of using the traditional 30-day mortality rate, this new model combines in-hospital death with discharges to hospice.
It's called a composite outcome, and it gives a more immediate, accurate picture of how well sepsis is being managed in real time.
The idea is that 30-day mortality can be misleading, especially in older adults. Some residents may survive hospitalization but pass away shortly after, or they're discharged to hospice care.
So if you only look at the 30-day window, you might miss the full story of how serious the sepsis episode really was.
The study also found that this new composite metric was more consistent across hospitals, and it could help identify top-performing care teams more reliably.
That could be really helpful in senior living, where early intervention and better hospital partnerships can make a major difference in outcomes.
It also points to how data reporting might need to evolve, especially when we're talking about quality benchmarks that drive funding and improvement efforts.
It's a good reminder that the way we measure care can shape the way we deliver it.
Next up, we're talking about the resurgence of tuberculosis and what senior living teams need to be watching for.
Right. Tuberculosis is making a quiet comeback in senior living communities, according to an article in Nadana's Director magazine.
And it's not just isolated cases. The report points out an uptick in both latent and active TB, particularly in older adult populations who may have weakened immune systems.
One of the challenges is that TB can look like a lot of other conditions: fatigue, weight loss, night sweats. It's easy to miss if you're not actively screening for it.
Exactly. And in senior living communities, close quarters and shared air systems can make containment really tough once TB is identified.
The article emphasizes the importance of routine screening protocols, especially for new admissions and staff. Catching latent TB before it becomes active is key.
It also highlights the need for thorough staff training, not just on symptoms, but on isolation procedures and how to respond quickly when a case is suspected.
Another point they made is that the public health system's focus on COVID may have unintentionally pulled resources away from TB tracking and prevention.
Which means communities may need to step up their internal protocols even more.
This is one of those clinical threats that doesn't make headlines often, but it has serious implications if we don't stay vigilant.
Let's shift gears now to an innovative approach to fall prevention using virtual reality.
Okay, so a professor at Temple University has developed a new virtual reality tool called Upright VR that helps assess fall risk in older adults, as reported by Temple News.
The system places users in immersive, balance-challenging environments to evaluate how they react to motion and instability.
What's different about this approach is that it doesn't rely solely on standard physical tests. It simulates real-world situations that might trigger a fall, like a moving sidewalk or a shaky elevator.
The technology tracks subtle shifts in posture and balance that might not be obvious during traditional screenings.
It's designed to identify fall risk before an actual fall occurs, which is a game changer for prevention strategies in senior living communities.
The system is also being used to help retrain the brain and body through repetition, almost like physical therapy inside a virtual world.
That could have a big impact, especially for residents who are borderline mobile or recovering from recent falls.
And because it's immersive, residents might be more engaged than they would be during routine exercises or assessments.
It's early stage, but definitely something to keep an eye on as technology becomes more integrated into care planning.
Let's move into our next story. This one's about a CMS decision to end a payment model earlier than expected.
Right. CMS is planning to end the end-stage renal disease treatment choices, or ETC, payment model earlier than scheduled, according to reporting from McKnight's Home Care.
The model was originally designed to encourage home dialysis and kidney transplants by adjusting Medicare payments to providers.
It was supposed to run through 2027, but now CMS says it will wind down by mid-2025 due to concerns about fairness and effectiveness.
Some providers argued the model penalized them based on geographic and demographic factors they couldn't control.
And that's especially relevant for older adults in senior living, where home dialysis options can be limited by health status or support systems.
The early termination raises questions about what kind of support or incentive structure will come next, especially for residents who might benefit from home-based care.
Without a clear replacement, providers may lose motivation to invest in home dialysis infrastructure.
It's a good example of how payment models shape the care options we're able to offer, and why it's important to have policy that supports both innovation and access.
Up next, a new bill aims to give assisted living residents more say in who can be present during their care.
According to McKnight's Senior Living, the legislation aims to expand visitation rights by allowing each resident to designate at least one support person to be present during healthcare services.
If passed, the legislation would guarantee that every resident can designate at least one support person to be present during healthcare services.
That includes everything from medical appointments to personal care interactions, not just end-of-life situations or emergencies.
The goal is to give residents more autonomy and ensure they have emotional and physical support during care.
It's a response to concerns that some visitation policies during and after the pandemic became too restrictive, leaving residents isolated during critical health moments.
The bill also includes provisions to protect against retaliation for residents who exercise these rights.
For senior living communities, this could mean reevaluating visitation policies and staff training to align with more resident-centered care practices.
And for families, it sends a strong message that their presence is not only allowed, but valued in the care process.
We'll keep an eye on this legislation and provide updates as it progresses.
Let's wrap up with an editorial that calls for a serious look at the future of assisted living.
Assisted living needs a reality check. That's the message from a recent editorial in McKnight's Senior Living.
The piece argues that the industry can't ignore growing calls for federal oversight, especially as more residents require higher levels of care and Medicaid becomes a larger payer.
Right now, assisted living is regulated state by state, and that creates big inconsistencies in what residents experience depending on where they live.
The editorial points out that with this patchwork system, some communities deliver outstanding care while others fall short. And without national standards, it's hard to ensure accountability.
It also highlights that as the population ages and the demand for services grows, the expectation for more consistent regulated care will only increase.
And from a staffing and training standpoint, more regulation could also mean clearer expectations and potentially more support.
The industry has long pushed back against federal involvement, but the piece suggests that may no longer be sustainable.
Whether or not federal oversight is the answer, it's clear the sector needs to take a hard look at what residents and families need and how to meet those needs consistently.
And that's a wrap on this week's HealthCap Weekly Wrap.
We covered an FDA warning about allergy meds, a new approach to sepsis care, and the rising risk of tuberculosis in senior communities.
Then we looked at virtual reality for fall prevention, policy shifts in home dialysis, caregiver challenges in dementia care, and a Minnesota bill that could reshape visitation rights.
Finally, we finished with a call for accountability in assisted living.
For more details on all these stories, check out the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog. Thanks for listening.